and we were reviewing our sales numbers for June, and really each month, the last 3 or 4 months, we've just had tremendous sales numbers, and these are usually a little slower times. Of course, January is always big, but, February through June tend to be a little slower, but thanks to you, we've had some great months. We can continue to see just tremendous growth, and so and again, thanks to you, our product and our offering just seems to really be resonating in the market, and I think the topic of today's webinar is such an important one because we are absolutely not like our competition. And the more we can understand what makes us different, the easier it is for our customers to understand what type of gaps they have that we're going to fill. And so, Scott asked me just, in my year that I've been here, what do I hear? And I mean, I hear a lot, obviously, from all of you and from many brokers that I talk about. But we are, as Scott said, very, very different. Yes, telehealth is important. It's, it's a way that we can, in a tangible way, directly decrease healthcare costs. And that's a big part of our value story, is lowering healthcare costs. And so it is important. But I think what really differentiates us is all the other things and capabilities that we do for the consumer, for the employer, in order to drive higher telehealth utilization. We need to be front of mind of the consumer. We need to be that company that they happen to think about on Sunday night when they were going to take their child, which we've all had, to urgent care, but decided instead to call HealthiestYou, and that saved them money, it saved their employer money. So what we're obsessed with at HealthiestYou is really, how do we stay in front of the consumer? What do we need to do to activate the consumer and to keep the consumer coming back to us? And so what I hear consistently from brokers and customers in the marketplace is that our competition is really, they're really selling telehealth in sort of a check-the-box fashion. It's a nice to have. They want to have telehealth, so the employer put this telehealth service in, and then afterwards, that's kind of it. They don't hear from the telehealth provider again. And what I hear about us is exactly the opposite. After we write the case is when the real engagement tactics take place. One of our commitments is every one of your groups is going to get a call from our retention team. Our retention team is measured on utilization. Really, I think of HealthiestYou as a marketing company, and we are constantly coming up with marketing campaigns to our in-force customers to drive awareness. And so, there's a lot of day in and day out execution that's taken place by HealthiestYou with your customers to stay in front of them. And then in addition to that, our technology capabilities, I haven't seen anything like it in the industry. What we're doing in terms of our portal, in terms of our new smartphone app, which is relatively new, and we really even haven't started a massive campaign to drive downloading of the app. But what you're going to see in the smartphone app is just tremendous capabilities and services right at the fingertips of the employees. I mean, things like, finding a provider, being able to find in-network providers, in-network specialists, being able to compare their prescription drugs to see if there's a less expensive drug out there, pricing procedures, a lot of things that are, checking to see where they're at with their deductible, looking for, seeing their ID card, things that are really meaningful for the consumer. And by us continuing to add these services, what's going to happen is the employees keep coming back to HealthiestYou. And again, we become front of mind. And if we're front of mind, when they do need telehealth services, they're going to think of us and they're going to call HealthiestYou. So, Scott, what I just continue to hear over and over is it's really what happens after the case is sold. It's the interaction between HealthiestYou and the customer to drive to drive awareness, to drive activation. I've had several brokers say to me, Pat, when I sell with this other company, I've got to get my internal resources to basically market to my groups. Matter of fact, if we want to send them a brochure, we've got to order it. And I kind of look and go, well, now you don't have to do that anymore, because that's what we do at HealthiestYou. That's our commitment to you, is that we are going to work really closely with you and your groups to make sure that they're thinking of us, so they're using us at the time of need, and ultimately we're driving down healthcare costs. So those are a few thoughts, Scott. I'll pass it back to you. And again, I just want to thank everyone for participating on this call today.
Thank you, Pat. Appreciate those words. You know, as a consultant or broker, you really need a business partner that pulls you into where your business needs to go, using the best of technology, the best that's available out there for your clientele to create that awesome solution. And that's what HealthiestYou does. We're that partner. We don't bring on any new clients direct to HealthiestYou, so we don't have a sales force going direct to employer groups. We distribute through brokers and consultants, agencies, TPAs, and whatnot, and payers to bring that business in. So let's jump to the slideshow here. We're going to walk through just kind of a product overview. We'll show you a new demo of the new app, which we're really excited about. Just released about probably 7 weeks ago or so, getting rave reviews in the marketplace. We have new exciting updates coming on that. But the goal here is just simplify healthcare, reduce claims to drive down costs, and just make it easy for everybody. But first, let's just take a quick look at history. So we all know, I think, TiVo. You remember TiVo? That came out, the first company that you could digitally record your TV shows. Now you got DVRs built into cable boxes and everything else. But what that really did was shift time. So Pat didn't have to run home from a busy day at work to catch, you know, Dancing with the Stars or The Bachelor. Okay, maybe it was more like a Packers game or Minnesota Timberwolves. But you could adjust your time, right, by recording those shows, and you could watch them when you wanted to watch them. It just shifted time for you. Google did the same thing, but they shifted information. I mean, massive shift there in how we get information, learn about things. It's just incredible, obviously, what Google's done with the information shift. Uber has done place shifting. They grew to $80 billion valuation in 5 years by simply making it easy for you to find transportation and take out the guesswork on moving yourself from one place to another, place shifting. And HealthiestYou, we're health shifting. That's what we're doing. We're making it easy for you to understand your benefits, use the resources, the best resources out there available to resolve and understand your health issues and options. So it's the first platform to shift consumers from expensive and inefficient healthcare endpoints. And we like to place that consumer right in the center. So this is what it looks like. It's got to be user-friendly, though. So we are on all different types of platforms. My dad, I'm his 24/7 technical assistant, right? If he has a question about anything from a DVD player to a phone to a smartphone, he calls me. So he prefers to just pick up that telephone and call HealthiestYou when he needs help. We've got, of course, the techies that now have the smartwatch, which HealthiestYou is on there. Really neat integration on how that works. Of course, your smartphones, your tablets, all the way over here to now the big screen TVs with our couch care initiative. So when you come home from work and you sit down on that couch after a long day, you fire up that recorded TV show, you can bring up the HealthiestYou app right on your smart TV, and you can get your health tip of the day. Maybe you're not feeling well, you want to connect with a doctor, hit a button there. We'll dial your phone up from your TV and get you set up with a consultation. But we centralize the options, so we take the most commonly used things in healthcare. So the question I love to ask all the time is, where does your medical deductible stand with your health plan? And people don't have any idea. Well, how do you find it? Well, I don't know, maybe I call an 800 number on the back of my health insurance card. Well, that was cool in 1985, but not in 2015, right? With the HealthiestYou app, you hit 2 buttons, you're there, you know exactly where your deductible stands. You can shop procedures. You can locate providers that are in network. So if you've got to schedule an appointment to a pediatrician for your child, very easy to do. 2 clicks of the buttons here on your HealthiestYou app, you're there, scheduling an appointment with an in-network provider with star ratings, with consumer rankings on that particular physician, and you're on your way. Of course, we have the 24/7 unlimited doctor access over phone. We have all the health management content loaded in there that's kind of tailored to your needs to keep that education going. Of course, you can find the best prices on medication. So we take the most commonly used things. We've got more really neat components we're adding to this very soon here in the next 30 and 60 days, which we'll keep updating you on here on our national webinars. But this is much different than a telehealth provider. We get put into that bucket because we do redirect a lot of claims via telehealth, a lot, the highest in the industry. But there's so much more than what we do. This is a key to being the front end of the plan for your clients. So let's look at the 24/7 doctor access just for a moment. Obviously, the reason why we put this on our platform is over 70% of the reasons we go see a doctor, they can be safely handled right over the phone. So right now, in your clients, if you do not have HealthiestYou in there, they're going to the primary care, they're going to the urgent care, they're going to the emergency room. HealthiestYou's goal is we're going to wipe out as many of those unnecessary visits from the plan by teaching them to go to HealthiestYou first. So call HealthiestYou. Let's try to resolve your issue there. Pull up that app. Schedule an appointment. If we can't resolve it, then we'll go back and use the primary care, urgent care, and ER. If you look at the top 9 reasons we visit the emergency room, it's these top 9 right here. These are acute issues for emergency room visits. Allergies. These top 9 are almost identical to the top 9 issues we resolve every single day over the phone, 48 states with a board-certified physician. No need to go in. Allergies is our #1 reason for people to call in right now. It's that time of year. All the doctors are licensed and reside in the U.S. They're all board-certified physicians. They're trained to diagnose, treat, and prescribe medication. We're the largest telehealth network in the country, 24/7, 365 access. We're in 48 states. Arkansas is on a temporary hold on telehealth. No telehealth providers are doing service in Arkansas. Idaho was on a temporary hold. Just now, July 1, they're coming back on. Video only in Idaho. And as soon as we wrap up our new video component, so we've had video in the past, we pulled it off the system, we're redoing it to make that user experience even better, and we'll be relaunching that here very, very soon, which we're excited about. We'll keep you posted on that. And here's how it works. To access the HealthiestYou doctors, there's 3 ways to do it. You can call HealthiestYou over the phone to schedule an appointment. You can go online to your member portal, or you can go on your smartphone app. From there, we make sure we have your medical history. So it's the same thing you fill out when you go to that doctor office. They hand you the clipboard. You give your medical history. We do that over the phone with a care line representative. We route the call to the appropriate doctor depending on the state you're in. The doctor reviews the patient history and then is connected to the member. If a prescription is required, we send that to the member's choice of pharmacy via eScript. Doctor updates the EMR with the notes, and then the consultation notes are stored in the HealthiestYou member portal for you to access, as well as your smartphone app. So here's the feedback. What are the members saying? Because our focus here is, of course, making that member experience as best as it can possibly be. 97% customer satisfaction rating, ranking it very high, awesome experience. 94% of our issues are resolved with no further action needed. So they called in, got connected with the doctor. 94% of the time, issues resolved. 9 minutes is the average callback time from the doctor. So faster than you can call in to find your doctor's phone number, schedule an appointment a few days later. You've already been on the phone and done the consultation with the doctor. Our calls are only 13 minutes long on average. We have a 95% client retention rate. So the point of that stat is when you provide HealthiestYou, when you offer HealthiestYou to their clients, and they say, yes, I want that, they keep it. They may switch out the health insurance provider. They may tweak the plan around a little bit, but HealthiestYou stays in there. They keep it. It's so valuable for the employees. And we have a $0 consultation fee, so there's no cost to access HealthiestYou for the employee. So the platform setup. So here's an example of the app. You download that app. You personalize your family tree. You can upload photos there. You sync your health insurance plan. You can view your deductible right away, because when you sync your health insurance plan, we're synced to features like the deductible. So you know exactly where you're at with that. Okay, I'm going to transition here to the smartphone app onto the screen. As I'm doing that, I want to remind everybody, Jesse Listen, which many of you know him, is on our broker and consultant support team, is manning the questions box. So if you have any questions, feel free to use your GoToMeeting control panel there, and Jesse will be happy to answer those questions as we're going along. All right, hopefully you all can see my iPhone 6 Plus sync to the screen here. This is the app. First thing you do, got your family tree, upload the photos, personalize that. You sync your health insurance plan. Okay, you click that insurance button. And again, the first time you download this, it walks you through a nice step-by-step tutorial. You put in the information. You can change the entire app to Spanish if you choose. Okay, I'll show you how that works. So if your primary language is Spanish, not a problem. You'll see everything change here to Spanish. So let me go back and change that. So we're the only app out there that converts everything to Spanish as well as our member portal. Whoops, I hit the wrong button. Let's do this here. English. Now I can actually understand here what I'm reading. Okay, so the deductible, we've showed you that. Now, geofencing, first thing we built in, this is really cool. So we geofenced all of the expensive care locations, urgent care centers. Next is the emergency rooms in our next rollout. The development team has now plotted all the emergency rooms as an example in hospitals. They'll go into the app. So you walk into, say, an urgent care center, 11 o'clock at night on a Sunday, you've got your daughter with you. She's got what looks like pink eye, right? You walk into that urgent care center if you're lucky enough to have one open in your area. If not, you're in an emergency room. Your phone's going to beep and vibrate. It says, as a reminder, it appears you're in an urgent care center. You have access to HealthiestYou. You can connect with a doctor now. So you're looking around that waiting room and you see all these people and then germs and hour-and-a-half wait to be seen. You're going to, you know what, I forgot I've got HealthiestYou. I'm going to connect right now. I'm going to dial in. We got your location, your member name, your phone number, which you can change if you want to be dialed back to a different phone number. Click connect now. We call your phone within 3 seconds. Nice personalized message comes on. We patch you right into our care line representative team that gets you set up with a doctor appointment over the phone in an average of 9 minutes. So we're going to geofence remind you. We're going to do the same thing on the pharmacy side. So we've plotted all the pharmacy location. You walk into a pharmacy. We're going to also remind you, if you're there to pick up medications, click check prices, put in your medication, because we want to try and beat your health plan price if we can. If you're on a high deductible, we're going to save you a lot of money. But 7 out of 10 times, we're going to beat your copay, even if you're lucky enough to have a copay. Now, this is cash. This is outside of the plan. Okay, so you can price your plan if you've got a $30 deductible for the generic form of Lipitor here, atorvastatin, and you can buy it at Walmart for $10.90. You got a choice. You can use your health plan, pay the $30 copay, whatever that is, or you can say, you know what, I like Walmart here. I'm gonna go pay $10.90. Clip that coupon to your screen. There it is, and you're ready. Just show that to the pharmacist. That's the exact cash price you pay. Now you can remove that off the screen. Well, let's leave it on there actually. So navigate the app. Click on this big orange button. By the way, we get rave reviews on that pharmacy pricing engine. As you all know better than anybody, the plans are changing. There's more out-of-pocket costs for the employees, for the members, for the patient. So let's help them find and save money, find the best prices on it by just taking a few seconds out to do that. Who needs help? Choose a family member. What do you want to do? You want to talk to a doctor. Maybe you want to find a doctor. So talk to a doctor is that telehealth process we just walked through. Finding a doctor, let's say you need to find a pediatrician because you need to take your son for their well visit or whatnot. It's covered under your plan. It brings up all the pediatricians in your area. Now this just goes out as a default, I think 5 miles there. So you can expand that. You can choose, I just want male doctor, I want a female doctor, or you can look up last name or practice name, and it shows you your options. See the star rankings there. Those are other patients that have visited that doctor. 5-star rankings come up first. So there's a social ranking there, just like you see on Yelp or OpenTable. Click on details of that doctor. Let's say you like Sophia here. Let's learn a little bit more about her. Languages she speaks, the bio, her practice location, specialties, education, and whatnot. Again, that star rating there. So you can say, I like Sophia. Where's she located at? Let's drop down the map box. There it is. Okay, I know right where that's at. Click Save. And again, that's going to show up as a card on your home screen. Now you got your doctor there. So you can call Sophia, make sure she's in your network because that is always changing, right? Double check that, schedule that appointment, you're on your way. You didn't have to call that annoying 800 number on the back of your card, listen to the hold music for a few minutes, and get connected eventually. You've already got your appointment set by the time you're even finding that phone number to your healthcare provider. Let's look at what else we can do here. Let's say a little price transparency. This is very high level now. We're expanding this out. This is just our first rollout, but let's say the doc says you need to have an MRI done. and it's an MRI of the brain. And you're thinking, I'm on a high deductible. How much is this going to cost me? Well, now you see. It's the average cost and the average submitted cost by the doctor, and now you've got an idea of what that bill's going to be. Okay, so this is based on your particular health plan and the average cost for that particular procedure in your area based on your health plan. So now you've got an idea. Next rollout, we're going to be plotting this on the map like we're doing with the pharmacies, and we'll actually be exposing the prices of different locations. Very exciting stuff coming. All right, well, that's a quick overview of the app. You do have your history tab here that shows you all your interactions with the app, the consultations you've done, the notes with that particular physician and whatnot, and it's there. All right, reminder, questions. Feel free to bring up that chat box there, submit those. Jesse's probably typing away and getting those questions answered. Let's jump back here now. I want to show you something called Radar that we're getting ready to roll out, which I'm really excited about. That's going to be the front-facing experience of our app on the next rollout. What this does, it's kind of similar to Uber when you pull up that app and you see where the black cars are and the cabs and whatnot. This is similar. You bring this up and it's got that little radar circle going on there that's bringing up all of the in-network providers. You know what? I might just try to bring this up on my phone real quick. I think I'm going to resync here. Give me just a second. This is pretty neat when you see it on the phone. Let's hop back here. Okay. 2 seconds. I should be synced up if everything works. Done. All right. There we go. So this is what it looks like. Let's go full screen mode. Okay, so this is our office location here in Scottsdale, and you see it's brought up a couple of little tabs here that you can click on. Okay, that's Safeway, so that's a pharmacy there, right? And if I scroll down, I can shut off the pharmacies, right? And then that goes away. It just shows the doctor locations. Maybe I want to find a pharmacy, and I want the doctors and the urgent cares off. I can shut those off, and then there's just a pharmacy, right? And I can zoom this out. So wherever you're at, you've got your radar there to show options. And we're also going to be reminding you that you can connect with a telehealth physician. There's another pharmacy just a few blocks over. What's this one here? That is a Smith's Food and Drug Pharmacy. So no longer, I should say, you have to deal with out-of-network visits. You know, if we use it at 11 o'clock at night in a Sunday example, and you just run into the closest location because you're tired, you don't want to look it up. Well, you just pull up your app and you say, you know what? Maybe if I go a block further, I'll be in network on that visit, and I'll save myself a ton of money, save the health plan money, save the company money, and everybody wins. So this is something we got called Radar that's rolling out. It's on our beta test site right now that's rolling out. I'm here next week, so very exciting stuff coming. Just wanted to show you a preview of that. All right, let's jump back here to that PowerPoint. So thanks for bearing with me on that. Now let's talk engagement and utilization. Okay, that's one of the main talking points of this particular call is the technology is great and fine, but if nobody knows about it, nobody's using it, it really doesn't matter. And that's what HealthiestYou's passion is. That's what we're focused on here at HealthiestYou, and that's why we're killing our competition on the utilization side. I know we got some good news there about Texas recently. Texas was considering putting a temporary hold on telehealth, which would have affected millions of Texans to have affordable access to care via the telephone and video camera, but that thankfully went in our favor. But you probably saw some stats there from some of our competitors on where their utilization stands. It's running at 2%, and they're hoping to get to 5% utilization. Okay, that's really industry standards. Well, HealthiestYou is running 42% utilization over 3,600 companies we have on the books right now and growing very rapidly. So what does that mean? So if you have 100 employees, our competitors are doing 2 consultations per year. If you have 100 employees on HealthiestYou, we're doing 42 consultations per year. Okay, and that's how you get claim reduction in costs, and keeping people on the job, and so on and so forth. How do we do it? We put together this engagement pulse slide to help illustrate that. So we have a team here at HealthiestYou. It's our client success team. So when you sell a group, as Pat was talking about in the beginning, and we get lots of positive feedback on this, when you sell a group, they come on board with HealthiestYou. We reach out to them, of course, and welcome them to HealthiestYou. We send them a nice admin kit. We put together a 365-day communication process broken down by quarter. So let's look at the first 3 months. When's your open enrollment, right? Is there any good communication opportunities coming up? We've got meetings. Maybe you have a health fair. Let's look at all that and set up a plan to make sure people are using this. We have a full team that's all they do. Call out every day. They're on site for the bigger groups. We send out a fulfillment kit here like this. It's the same company that does the Amex Black Card. It's a very high quality, nice fulfillment kit that explains the benefit, encourages them to download the app. I need to mention that 42% utilization, that's prior to the smartphone app coming out. So you can imagine all that incredible functionality I showed you there on the app, geofencing, reminding them. We're going to blow past that 42% utilization here in 2015, I believe. We send out an admin launch kit to the admin. We have co-branded enrollment sites for the employees. We do, of course, basic monthly email, fun, tongue-in-cheek type communications to keep HealthiestYou on the top of their mind. And we get people engaged. We also monitor the utilization. So smaller groups, those groups, under 25 lives and whatnot, we're going to look at that at the 6-month mark or the year mark. Okay, we got to be careful with the HIPAA issues on utilization with small groups. The bigger groups typically do a quarterly review. If you need a report at any time, of course, you can call us. We'll provide that to you if you've got a meeting come up with them. But we look at top diagnoses, top prescriptions that were sent to the pharmacy. We look at call times. Now with the app, we don't call locations, right? And so we provide all this data back to the groups to know exactly how people are using it and what that means. So we ask them when they call in, hey, if you didn't have HealthiestYou, what would you have done? Well, I would have gone to the emergency room. It's my only option, right? Well, we know once they say that, that information goes back to the group. And if that group's average emergency room visit's $1,300, like the national average, well, congratulations. We just kept $1,300 of unnecessary expense out of that plan on that one redirected visit. We call it claim redirection. They would have went into the emergency room if they didn't have the HealthiestYou and the simple ease of that, but instead they did. They resolved their issue with a phone. That's massive savings for companies. So we compile that, we share that back. And that's why our retention is so high. When you have 42% utilization, you just don't get rid of HealthiestYou. It's too valuable. People are using it. Here's a case study real quick. 146 life group. They had our main competitor for 2 years prior to us. Saw no change in their claims. Again, they had that 2% utilization. First year with HealthiestYou, they blew away the utilization. Saw a 39% reduction in claims, a 37% reduction in payments. Saved over $30,000 in unnecessary claims out of the plan. We love to see these numbers. 2.2 fewer paid time off days per employee. So this data was sent to us from the HR of this company and the payer rep. They sent this over and said, wow, man, this is really working. Here's a 2,200 life group. Again, this one's self-insured, so 5,000 employees, 2,210 on the plan. First year, now they're in their third year with us. Reduced urgent care spend by 37%. The Humana rep about fell out of her chair when she saw this. They did 1,071 telehealth consultations. Okay, they have 70 locations, 30 HR directors. We trained every HR director. We made sure all 70 locations had their welcome kit. $214,000 in savings, unnecessary claims kept out of the plan that first year. At 44% utilization, so right at our average. And they went back and they changed the plan. They said, we don't need to do a $25 PCP copay. Let's bump it up to $35. Let's bump urgent care up to $75. They changed the plan and carved out more savings for the company. And the employees don't push back because they've got HealthiestYou in there. So it's a win-win for everybody. Let's look at benefit plan design. So how do you present this to an employer group? So what we did is we interviewed our kind of field advisory board team, and we said, looked at the top producers with HealthiestYou and then also the top producers with the major payers, United Healthcare, Aetna, Blues, all on our advisory board. And we said, how do you present it? And this is the flow that they're doing. So they're leading with HealthiestYou. Why? Number one, it differentiates themselves from the competition. Okay, it's something new, it's something sexy in healthcare, right? which is hard to say in the healthcare space, but it gets the attention of people. So they start with HealthiestYou. Why? Well, if you can resolve 70% of your healthcare needs with HealthiestYou, why would you not start with that as the plan design? We're going to give free access to the employees. Okay, no consultation fee. We've got the docs waiting 24 hours in 48 states. Instead of the employee waiting for the doctors are waiting for the employee. You're syncing your health plan so you can find providers easy. HR directors love that because now they don't have employees calling them to say, hey, how do I find my deductible? How do I find a pediatrician? Go to HealthiestYou app. Hit 2 buttons, you're there. Prescription savings, right? Help them find the best prices on medication. We also want to keep those unnecessary prescription claims out of the plan. That can drive down your costs and renewals. Then you plug in your major medical, and that's where your expertise of everybody on this line comes in. What's the appropriate major medical plan to package with that? Maybe you're going self-funded. Maybe you're bumping up that deductible. Maybe you're going HSA. There's some great plans out there now that are, fully insured plans as well that maybe have 3 doctor copays. They can be doctors or they can be specialists that you get for a really reduced price. And then after that, you're on your own. Well, that plan is super affordable. You plug in HealthiestYou. Now you probably won't use those 3 copays because you're going to call most of the time, but you got them there if you need them. You can use them for specialists maybe. And you package that up and you got a plan that's very rich and super affordable. Then you might want to plug in some supplemental medical products, maybe some ancillary products, the dental, the vision, the EAP, whatever you want to plug in with that, and then down to your financials. So if you follow this flow, you lead with HealthiestYou, kill the competition with it, wrap the other benefits around it. Now you've created a benefit plan design using the best of what's available today in the marketplace. So we're really the perfect match for fully insured groups. Half of our book of business is fully insured, under 100 lives, maybe a few groups over 100 lives in there. Self-funded's obviously a natural fit. You can see that savings every single month from the claim redirection. We're being packaged up with the ACA plans. We use that phrase we started over a year ago, how to turn bronze into gold. Take a bronze plan, package it with HealthiestYou. It feels more like a gold plan, but it's the cost of a bronze. Doing a lot of work with the MEC and limited med plans, plugging in on that, becoming the front of those plans. Partnering with the payers, the TPAs, a lot of association business we've won recently. Great for if you're selling individuals, package HealthiestYou with it. Online administrators are perfect. Great product to go on with online administrators. Lots of growth happening there. So let's look at pricing. What's the cost of HealthiestYou? Typically when brokers or consultants see this pricing, they're like, wow, that is super affordable. I was expecting it to be much higher priced. But this top row here, the blue column, the blue row, employer paid, which is a majority of our business. Employers are paying for this, included as part of that benefit plan. Now the employee may be contributing to that. They may not be, but it's typically packaged in there as non-voluntary. You choose your plan, HealthiestYou comes with it. 2 to 99 employees, $9 PEPM. We've got a 15% commission built in there for you on distribution. Paid every single month for as long as I remember. There's no consultation fee. So you can call in as many times as you want. And we got people using it, 8, 10 times a year, which is fantastic. They're having massive savings, keeping those claims out of the plan. And you'll see the price go down here as the group size goes up. When you get over to above 1,000 employees, we like to do a custom quote if we can. You're welcome to sell it at the $6 price point. We have a lot of folks doing that, but if you want to maybe have us look at sharpening that pencil up a little bit, see what we can do, don't be shy. Reach out to us. We're happy to help and see what we can do and look at those opportunities and help you win that business. Voluntary, so individual and family in the voluntary side, not a group plan, $11 for the individual and $15 for the family per month. Same rules apply. You got a 15% commission. No consultation fee. And I'll tell you what, I know people just using the prescription savings program, and they're saving far more per year that even offsets the cost of this $15 PMPM before they even use the doctor side of it. So there's tremendous value on the individual and voluntary side as well. Okay, well, how do you get started the first thing we always encourage you to do, and the first question we get asked all the time after doing a broker training is, I want this for myself. How do I get this for myself? Well, you want to register on our partner portal, which I'm going to show you here in just a minute. Everything's online. You register online. You can go in there. You can buy the Healthiest You membership at a 30% discount. So we're going to give you a huge discount just for being our distribution partner. I mean, it's ridiculously inexpensive. You've got to have it. The value is tremendous. Plus, you got the app on your phone. You can show your clients. You can demo it. That's the easiest way to explain Healthiest You. Well, let me show you my app. 2 seconds, I'll show you my deductible. 3 seconds, I'll find a provider. You know, a couple seconds, I'm connected with a doctor over the phone, right? You're ready to go. So you want to sign up for that partner portal. I'll show you here in just a moment. But we also have a broker support team. Now, if you're working with the general agency, fantastic. Our general agency partners are up to speed. They're welcome to help you package that deal up and close it. We have a broker support team here at HealthiestYou that is also here to help. You want, maybe you're nervous to present HealthiestYou that first time to your client. Let us do it. Just take that stress away. Plug us in on a go-to meeting. We do these every day, all day long. They're tremendously successful. Let our team present on your behalf. We'll do a demo. We'll answer questions, make it easy for you, and 9 times out of 10, we close that group with HealthiestYou, and we assist on those demos. So very positive results on that. Okay, well, I'm going to jump to the partner portal here as a wrap-up just to show you some of our tools. Again, this can be found online here at HealthiestYou.com. Click this Partners tab, and you can create your own account or you can log in here to the partner portal. When you log in, this is what it's going to look like. You can get contracted here, request a contract. Somebody closed down the tab here on our demo site, but there'll also be another bar just like this where you can buy the product at a 30% discount. Choose your plan. It's like $7, I think, for an individual plan, and really like $10, I think, for the family plan, but really inexpensive. And you've got the HealthiestYou program. You'll see your activity feed, your tasks as you use the system. You can do email marketing in here. You can generate proposals. You can do ROI documents for those self-funded groups, which are really cool. We have all kinds of health insurance news plugged in here every day. You can go right to Facebook, Twitter, LinkedIn, email it. You have access to the good information that's coming around here. Whoops, I don't want to email. Let's take a look at our calculator real quick. So I love this piece here. So if you're working for with a self-funded group, you do the presentation, they like it. You also want to show them what this can look like on the cost side of this. The savings calculator is what we call it. So let's just do a quick run through on this. Let's say you got a self-funded group with 1,000 employees. We're going to include the dependents at no cost. So let's say we're going to use our $6 price point for this group. Dependents are included. Let's say they're doing 2,500 doctor visits a year, and they're doing 800 urgent care visits, and maybe 500 emergency room visits. Of course, you guys will have this data, and you can plug in the real data, and then you put in the average cost per visit. I'll just use some national averages here. $125 for primary care, $175 for urgent care, and we'll do ER at 1,000, even though it's typically about $1,400. Let's say we can just simply redirect 10% of those visits. I mean, this would be an underperforming group. Click crunch the numbers. So 380 visits, they're going to do over the phone, resolve their issue instead of calling in. Just 380 out of 3,800 total visits. So this would be underperforming. They'd be running about 38% utilization instead of that 42. Well, they're spending $72,000 a year for HealthiestYou, but they're saving $95,250. They could just redirect 10% of those visits. 32% return on their investment. This is powerful stuff here. Okay, we'll look at the 3-year savings by visit, by location. We'll also highlight some reduced absenteeism figures. We saw the PTO days change with that one group. Went down by 2.2 per employee that first year. Well, it costs companies a lot of money to have an employee away from work. The environmental impact, so CO2 footprint, fuel savings, and you can go back and you can redo these assumptions and say, look, this group, they're great communicators. We can hit a 15% redirect. What's that look like? Now you're spending $72,000 to save $142 in a self-funded group. It's a no-brainer. It's just not one of those nice-to-haves. It's a must-have. for those groups on the front end. You got that cool engagement with the app and all the technology and the new stuff we're rolling out. This is becoming a critical component to that benefit plan design. This is the first place you go, and you build everything else around it. So the calculator is nice. You can do email marketing in here. Simply put in an email address, send out an invitation. That's our superhero invitation to, so you can send it to brokers or people, other team members, or you can have a HR-focused message, which is check out HealthiestYou, right? Watch this little video, learn about it. And then we have our flyers in here, so if you just want a basic flyer or PowerPoint presentation, and a presentation I just walked through is loaded in here. Our overview flyer is a popular flyer that's got information about the app on here. You can print that off, you can email it. It's all right here. And then again, use us to help you present. You have your own website, your own landing page you can email to HR directors. You have your own enrollment site for individuals. So let's say you've got an individual who wants to enroll, just send them a link to your page. We track that back to you. They can choose a plan, learn all about it, and you get paid the commission on that, and you get credit for that particular sale because it came through on your own website. It's all branded to you. All your information's there and all the communications that go out. All right, I think we will go ahead and wrap up. I'll take a couple minutes here to look at this questions box and maybe repeat some of these here just so some other folks can have the answers to some of these questions that came in. First one is, will you be able to send the recording via email to us? Yes. We take this presentation here and we upload that to our YouTube page, and that comes out via email. So look for that later this afternoon, maybe tomorrow morning. This entire presentation is recorded. You can click on that and you can watch the presentation good, or send it to one of your team members there. Okay, questions coming in here. When will the app be available for Windows Phone? So it is on the iOS platform and Android platform. Windows, not available yet. I know that's in the queue, and I do not have a date for you on that, so I apologize for that, but that is something that we're looking at right now. Windows has a very, very small market share. Android and Apple by far have the majority of the market, so we obviously started with those two, but are looking at the Windows platform now. Okay, you must have some integration with carriers to be able to sync to the deductible, etc. What carriers can you sync with, and is it available for all employer sizes? So good question. Yeah, we are synced up with the carriers. We have 470 different plan and carriers loaded in there, which covers about 90% of the market roughly. So most of the plans that you're working with out there will be loaded in there, and we're adding more in every single month. But we're covering a huge percentage of the marketplace today with that. Okay, curious how a doctor could prescribe RX without an office visit. So this is being practiced. They call it telehealth, and that's and I think the first time you use telehealth yourself, it really, the light bulb goes off. Okay, these doctors are tremendously good at walking you through very detailed questions about your symptoms and coming to a conclusion. If there's ever a point where there's a question with that doctor, there may be something more serious, they're going to say, you know what, you got to go in. But that's only 6% of the time. 94% of the time, they can take care of that right over the phone. So hundreds of thousands of consultations, actually might be in the millions by now, done with over the phone with a patient. Medication may or may not be involved. Majority of the time it is, with zero malpractice issues to date with telehealth. And this has been going on, these consultations have been going on since, 2004, 2003, so about 11, 12 years now. Doctors are very good at that, at walking you through those. And again, it's acute issues, colds, flus, infections, allergies, those kind of things. The major chronic issues, they may be able to answer a few questions for you, but our doctors are not there to handle chronic issues. Basic questions with chronic issues is fine, but that's going to be referred out. What other languages do you have available besides English and Spanish? So just English and Spanish today. Okay, the video, question around video. As I mentioned, we pulled the video off the platform right now to greatly enhance it. It will be coming on here very soon. We're hoping get here this summer. So just in a couple months is our goal. Definitely in 2015. But we'll keep you all posted on that. Everything's done on the phone right now, which is really still the overwhelming preference of folks. We've had video built in our system for a couple of years, and still 99% of our consultations are preferred over the phone, but we do see that changing over the next few years. Does the sync happen automatically? I think that question's around the health insurance plan. You do put in you choose your insurer from a drop-down box, okay, on the member portal or on your app. You choose your insurer, you put in your group ID from your membership card, your health insurance membership card, and then it's synced up. Okay, if a member has an active relationship with a primary care doc, how does that medical record of HY feed back to that doc? So just the same way it would feedback if you went into an urgent care center and you had that consultation. They can fax that information to your doctor if you choose, or they can just send you away with the notes and you can email or take it into your doctor. It's pretty similar with a phone. We can fax those records over to your doctor if you choose, or you can just simply forward them from your member portal or print them off and take them in, whatever you choose there. Okay, let's see what else here. We'll knock out a couple more of these questions. How do we access marketing pieces to increase employee participation? So we are creating a new video series right now, which we're really excited about. We're looking to have out here by the end of the month with the new app, the new messaging. It's going to be fun, memorable. So those are going to be coming soon, all the marketing pieces. And again, we take care of that at HealthiestYou. If you want to support us in that effort, we absolutely love that. That just helps utilization more. So just call our support team. You can find us at support@healthiestYou.com, or our phone number here is right on the website. Just click this contact button. Here's our direct line to our broker support team, email, address, and we'll get you what you need if you want something special for that particular group. Okay, can we receive a copy of this presentation? Yes, the presentation is in the partner portal. So just log in, create your own little account, click under this employer flyers tab. You've got the presentation right here, which is the PowerPoint with the app information on it, or simply email us or call us here at HealthiestYou, and we'll be happy to get that to you. Okay, let's see. I got a couple questions about how we're connecting with the doctor network, or excuse me, not the doctor network, the insurance information. That's done through multiple databases that we aggregate and throw out duplicates and put into our system here. That'd be a long conversation. Do you utilize GoodRx? We used to use GoodRx and just have recently actually created our own pharmacy shopping engine solution, which is far more advanced, that we're really excited about. So that's all proprietary there. Can this be sold as an individual plan or only to groups? Definitely can be sold as an individual. Okay, some questions about one of our competitors going public. Yes, we've known they've been going that way for a long time. Anything you've learned to sell against them? Well, the main one is simply, hopefully we did a good job on this presentation here showing the functionality difference is just huge on all of the things we offer technology-wise, but the ability to sync your health plan, shop and price procedures. Utilization, again, their average utilization is 2%, ours is 42%. So what's better for your client? Providing them a product that nobody's going to use but they're going to pay for, or providing them a product that they're going to pay for and get tremendous value out of? So that's a decision you need to make as a consultant. Do you want a product in there that they're going to drop after year one because nobody used it? Or do you want a product in there that they're going to rave about and keep with a 95% retention on all of our book of business and really get tremendous value out of? I think it's a pretty, hopefully an obvious answer there on what you want to really provide to your client. Okay, more questions about the PowerPoint presentation. It's online at the partner portal. Okay, question around utilization. So is the 42% utilization the utilization of the telehealth doctor consultations or the utilization of all components of the program combined, pharmacies, wellness, info, etc.? So the 42% is just the telehealth doctor consultations. We just kind of highlight the other items, but if we've got 100 employees, we did 42 consultations that year. So doctor consultations, that's not factoring in the other parts of our offering. So what we want to look at is how many claims do we redirect? That's why we just use the telehealth within that utilization number relative to your spend, right? So it's kind of that ROI document we walked through. How much are you spending? How many claims are you redirecting? That's why we're looking at the telehealth side. Okay. What marketing materials do you have to share with clients when introducing them to HealthiestYou? So we've got lots of great stuff on the partner portal. Log in there, create your account, take a look at what we have, and if you need something, certainly call us. All right, rolling through some duplication on the questions here. Okay, when using the calculator, the HY savings figures show you net of what our customer would be paying. So yes, it shows you what they spent, okay, for the year, and then it shows you what they could see in claim redirection, and then it shows you the ROI on that percentage. So if you spent, in that example, I think it showed $72,000 for the year, but they saved, I don't remember, what was it, $95,000. So they've got a nice ROI on their investment. So we show what they spent and what they saved, and what that percentage was. Okay. So here's a question again around, and this probably was an older question which we've already covered, but how do we quickly explain the difference between HY and some of the competitors? Utilization, utilization, utilization. And if you have that app on your phone and you can demo that to a client in just a minute, right, with just showing the app and the functionality on that. None of our competitors have this screen here I've got. They don't have the ability to sync all of your benefits. They're not geofencing, reminding you when you walk into an urgent care center, a pharmacy, an emergency room, that you got HealthiestYou. They don't have any of that. They can simply connect you with a doctor when you need it, which is valuable, and no one's going to know they have it because there's no marketing done. Where, again, let's look at this. They got the 24/7 doctor access. Quickly identifies the massive amount of differences between HealthiestYou. They really shouldn't even be compared, honestly, because the technology, the functionality, the user friendliness of this, the results on our utilization, 42% versus 2%. I mean, what's best for your client? HealthiestYou by far is something they're going to get tremendous value out of. All right, I think we're getting to the end of the questions here. You mentioned Texas. Texas is live with telehealth. Let me just clarify that. Texas is live with telehealth. The medical board lost the injunction there to put a temporary hold on that because they were saying it was unsafe, which there were zero malpractice suits or any instances of telehealth being unsafe there in Texas that they're able to come up with. So telehealth is live in Texas and staying that way for now, and we'll keep you posted if anything changes on that. Okay. Okay, since the utilization of the service, you aren't paying towards your deductible, how do you address that? Well, let's take a closer look at that. So let's say you've got a $40 copay in your health plan to go see your doctor. And it's $0 with HealthiestYou because there's no consultation fee. So you can go into the doctor and you can pay that $40, okay? Or you can call HealthiestYou for free. Now let's say you're on a high deductible plan, which is more around what this question is. So let's say you're on an HSA. And you go into that doctor and it's $120. You spend that $120, that would be applied towards your deductible. But HealthiestYou's free. So would you rather spend the $120 and have it applied to your deductible, or would you rather spend nothing and have that issue resolved? And so there's nothing really to apply to that deductible. Now on the pharmacy side, let's look at the pharmacy side. So if the cash price is better, so let's say you've got, I'll use that example, that $40 copay for the generic form of Lipitor, and you can find it for $10.90. Now you could submit that receipt and see if they'll apply that towards the deductible. But wouldn't it be more valuable to save that $29.10 in that example? Or would you rather have that applied towards your deductible? What our members have overwhelmingly said is they'd much rather pay the less price even if it's not applied, right? So they just want to go gravitate to that less price. I hope that answered the question. Another question around the doctor encounters. Right now they're telephonic only, which is the overwhelming preference of our members, as we've had video in there for a couple of years. Video is on a temporary hold with HealthiestYou. It will be back very soon. As we rolled out our new technology platform and our app, we've held the video component because we're still improving that process. Okay, so we're hoping here by the end of summer, video will be back on and live, an incredible experience. But we wanted to get the new app and the platform technology out because overwhelmingly people prefer the phone right now anyway. But video will be coming live very soon with HealthiestYou. So we will keep you posted on that. Okay, I think we get some really positive feedback from folks on the chat box here. Appreciate that. Idaho is video only right now. Yes, so we're on a temporary hold servicing Idaho members now since they just are coming back online video, but we will be servicing them very soon. We'll keep you posted as our video functionality rolls out. Okay, approved in Massachusetts. Yes, we are providing service in Massachusetts. The only two states right now are Arkansas and Idaho that we're not providing care in. Okay, I think we've got all of the questions answered. So thank you everybody for joining. We had a great big audience today here on this Thursday in June. We do this the first Thursday of every month. Thank you for joining. We'll send a follow-up email with the recording of this presentation. Reach out to us again if you have any questions, support@healthiestyou.com, or you can reach us at 602-663-9595, 602-663-9595 if you have any questions. We've got a full support team here ready to help you all. And thank you all so much for taking time out. We appreciate everything you do, and those of you that are new, we look forward to working with you. So have a great week, and thank you, everybody.